Hey y'all, it's your girl Marquilla, and today I wanted to respond to one of the questions that I have about what is PCOS, which is actually a great opportunity to talk about it because this month, September, is PCOS Awareness Month. So let's get right into it. So, quick introduction. My name is Marquilla. I am a mom, a wife, a certified wellness coach, mindset mentor. I will be a practitioner of meditation, mindful meditation, and I am also the host of the Whole You Candid Conversation, which is a live stream show that airs here on YouTube as well as on my Facebook page at the Whole You LWC. I also share my journey after having VSG surgery, which is a weight loss surgery, the vertical sleeve gastrectomy surgery. I had that surgery back in October of 2021, and it is almost 1 year for me. And I have lost over 100 pounds to date after having that weight loss surgery. So anyway, why I am making this video today is to talk about PCOS. I have suffered with a number of health issues, that including PCOS, which is one of the reasons why I end up having weight loss surgery. And so one of my viewers asked, what is PCOS? And so in honor of PCOS Awareness Month, which is this September, I am going to talk a little bit about what PCOS is, who it affects, some of the symptoms, as well as my experience having PCOS. So let's get into it. So all of the information that I will be sharing with you will be me citing directly from www.womenshealth.gov. So any of the information that I'm sharing, that is where I am referencing. So you can also visit that website to get more information about PCOS. I would like to add this disclaimer: I am not a medical professional. So any information that is shared is just information that I am citing or referencing. But if you have any questions or feel like you are experiencing some of the symptoms related to PCOS, please consult your medical doctor or medical professional for more help. So let's get right into it. I want to just say I am going to be looking down at my notes because I cannot remember all of this information. So here we go. So PCOS, known as polycystic ovary syndrome, also known as polycystic ovarian syndrome, is a common health problem caused by an imbalance of reproductive hormones. This hormonal imbalance creates problems in the ovaries, and this is all according to womenshealth.gov. With PCOS, the egg may not develop as it should, or it may not be released during ovulation as it should be. So PCOS can cause missed or irregular menstrual periods. Irregular periods can lead to infertility, which is the inability to become pregnant. PCOS is one of the most common causes of infertility in women. And also with PCOS, there is the development of cysts, which are small fluid sacs in the ovaries. According to womenshealth.gov, PCOS can happen at any age after puberty. Between 5% and 10% of women between the ages of 15 and 44 or during childbearing years have PCOS. Some of the symptoms of PCOS include irregular periods, as mentioned before, too much hair on the face, the chin, or parts of the bodies where men usually have hair, and this is also called hur-suh-ti-zm. Please forgive me if I'm not saying that right, but I do believe the proper pronunciation is hirsutism. You also can develop acne on the face, chest, and upper back, thinning of the hair or hair loss on the scalp, which is male pattern baldness, typically like top of the head, the edges, weight gain or difficulty losing weight, darkening of the skin, particularly along the neck crease, or in the groin and underneath the breasts. You can develop skin tags, which are small excess flaps of skins in the armpits and neck area. So the exact cause for PCOS is unknown, but it has been shown to be linked to other diseases such as diabetes, high blood pressure, unhealthy cholesterol, sleep apnea, as well as endometrial cancer. There is no exact test to diagnose or discover if you have PCOS, but things that they do look at is they look at certain things within your physical exam with your OB-GYN, pelvic exam, which would yield like issues if you have developed cysts on your ovaries, a pelvic exam to find out if you have cysts on your ovaries, as well as blood tests to check your androgen levels, and to see if you are pre-diabetic or have diabetes. So just to explain what is androgens, that is also known as a male hormone. And women, we as women, we do make small amounts of it, but women with PCOS have more androgens than normal. And another term that could be used is testosterone. The other part where I was saying about the blood test is they can check to see if you are pre-diabetic or have diabetes. What they're basically are looking at is the levels of insulin. Having high levels of insulin is also an indicator or a possible indicator of having PCOS. Insulin is a hormone that controls how the food you eat is changed into energy. High levels of insulin, this is according to womenshealth.gov. High levels of insulin, insulin is a hormone that controls how the food you eat is changed into energy. Insulin resistance is when the body's cells do not respond normally to insulin. As a result, your insulin blood levels become higher than normal. So for me, I found that I had PCOS through the blood test. So I create high levels of androgens, which is the male hormones, and I also have high levels of insulin, which I've developed insulin resistance. And so I have had skin rashes because of that. I have had darkening on my face as well as on my neck because of my insulin resistance, as well as having like have my abdomen or my stomach being big because of the high levels of insulin. There is no cure for PCOS, and because of that, there isn't a specific treatment for PCOS. And what doctors mostly do is try to treat the symptoms around it. There are so many health risks or health issues that are linked, or diseases that are linked to PCOS. I'm going to specifically speak about my own experience as well as what is listed on the womenshealth.gov. So basically doctors, and this is just me paraphrasing and based off my experience and what I've researched, but basically what doctors do is they might treat you for pre-diabetes or the insulin resistance, or if you're, sometimes when you're pre-diabetic, which was me in my case, depending on your levels, your blood levels, you might not, or your A1C, you may not need medication, but if you are at a higher risk of developing diabetes, they may give you metformin. So a lot of people, or a lot of women that has diabetes is put on metformin. Actually, I can't say a lot of people because my husband, his A1C was high, and he is also at a greater risk of developing diabetes because both of his parents have it. So he also used metformin, but it's pretty common for women to use metformin when they have PCOS and their A1C is high. So a lot of times doctors just focus on treating the diseases that are linked to it or the symptoms if they can, but there is no specific treatment for PCOS. And I should add that they highly recommend women use birth control if they have PCOS. I use the Mirena IUD. I have used that for more than 10 years now. So my doctor is very strong on me staying on the birth control. I know a lot of women prefer not to. I kind of don't want to either, but it is that option. It's highly recommended by physicians for if you are a woman with PCOS to use birth control to sort of manage those symptoms. and to prevent endometrial cancer, as my doctor put it to me. So yes, that is one way of treating PCOS. And there are some anti-androgen medications that sort of block those male hormones. I am not 100% familiar with them. If you are watching this and you know a little bit about those medications, or if you yourself take them, I would love to know more about them. You can share your comments or your experience within the comment section. So that's what they also have. Another thing, if you are a woman who is dealing with excess hair, my tongue. If you're dealing with excess hair due to having PCOS, there are hair removal creams. I know the one that I'm going to be using is the Vaniqua or Vanic. Look, I'm very horrible with this stuff. Or you might look into laser treatment or things like that to remove hair. I wax. I'm going to look into laser treatment. There's also electrolysis, but those are some things that you can do to help with the hur-suh-ti-zm. And I swear, I promise you, I think I'm saying that wrong, but the excess hair that may grow on your chin, your face, your chest, or your body. Of course, any physician, and I've heard this, most physicians are going to recommend the best way to treat your PCOS is not only what I've mentioned before, but also to lose weight, to change your diet and things like that. I kind of find this sometimes to be problematic because I might have heard that so many times before having weight loss surgery. If you just lose the weight, you'll feel better. Let me just say, before I had weight loss surgery, I did exercise. I did change my diet. I lost about 40 to 50 pounds. And because I have other health complications, I experienced a flare-up. I also injured my shoulder, but I gained the weight back. Before I even had all of that, the flare-up and gaining the weight back, I only lost so much weight and then it just stopped. And one of the major issues that I had was the weight in my stomach. It didn't matter like what I would eat or whatever, I would just bloat. So certain things can make it very hard to lose weight, and I am not the only woman that have experienced that. There are so many other women who talk about how hard it is for them to lose weight having PCOS. So just be mindful of that yes, losing the weight is helpful. After having the weight loss surgery, and this is not me pushing this on anyone, what you decide to do as far as losing weight is your choice. But the reason I had weight loss surgery was not only because I wanted to lose the weight, but obviously the main reason for me was my health. I have osteoarthritis, I have fibromyalgia, I've struggled with chronic migraines since I was a child, and I also have PCOS. All of these diseases were debilitating. It made it really hard for me to function. Yeah, I can exercise, I could go to work and do things. I'm a mom and a wife, so take care of home. But when I would have flare-ups, I would be really exhausted. I would be fatigued. I would have mood swings. All of those things made it hard to function in life. And so that was my number one reason for having the weight loss surgery. And as a result of doing so, I have seen a drastic change within my health. Now, because there is no cure for my osteoarthritis or PCOS or fibromyalgia, I still deal with things and I work to treat them, but I have not had to take as many medications as I did before that. And so that is very huge for me. Also, my A1C is lowered. So all of those factors are very important for me. So having that weight loss surgery made it easy for me to take control of my health and to exercise, and losing the weight has changed my health drastically. Now, some of the symptoms that I personally experienced having PCOS is the weight gain. I had rapid weight gain after my third child. Literally, I gained about 70 plus pounds within 6 months. I deal with a lot of cystic acne on my chin. I actually have scars on my chin. And I did have on my cheeks. They've gotten better. And I also work with a dermatologist to sort of clear up the scars and the hyperpigmentation. But I did have like a dark mark on both of my cheeks for the longest. I had the darkness in the creases of my neck, on the back and in the front. I do get the back acne. I also have like sort of rashes all over my body. I don't have these things anymore after having weight loss surgery. So I just want to add that, except for like the cystic acne that does occur. I do get acne on my face that does occur from time. Like it's just one of those things. But I have experienced hair loss at the top of my head. If you see my previous video about my 11-month post-op VSG video, I talked about my hair loss. My hair has thinned, and this would go away, come back, where my hair would go back and then it'll come back like months later. But I always will lose hair at the top of my head. My edges have thinned out. Another thing with PCOS that a lot of people don't talk about is the flaky hair. My hair is so flaky that I actually I do treatment through my dermatologist. I use a formula called clobetasol with them on my hair. It's just a liquid solution. I put it on. I can use it every day. There's also a oil that she recommended, but I had stopped using it. So I use the clobetasol. I use acylic acid for my face to help with the acne, and I also use like a compound where it's tretinoid, clindamycin, and it's another chemical in there to help with the scars. I will be using a cream to help with decreasing the hair growth on my face because I have chin facial hair, which developed after my first son, which is my second child. I developed the chin hair here. It's out of control. I'm going to show you guys. I don't know if you can see that, but my chin hair is out of control after I had weight loss surgery, because with any surgery, your hormones are thrown off. And they have to be rebalanced. It's not my first time ever having surgery, so I kind of know that from experience. So I waxed my chin. I'm going to switch to laser because I am spending more money to wax my lip and my chin. I get hair here on both sides, my chin, and on my lip now. I have a shadow. But yeah, it was pretty bad. I noticed also like under my armpit hair was growing extremely fast. So these are things that I'm experiencing with PCOS. I also have the bloated belly. I still bloat occasionally. Mood swings, I don't experience that as much. Headaches, fatigue, fibromyalgia is actually linked to PCOS. I have had fibromyalgia for over 10 years. Also migraines, and sleep apnea. I have mild sleep apnea, but before weight loss surgery, it was mild, but it was a little bit more severe than what it is now. So weight loss surgery has definitely improved my sleep apnea. I do not need to use the CPAP machine anymore, but I will be using a oral device, which is just like a mouth guard type thing. So yes, I think that I covered everything with having PCOS. And so I hope this helped my viewer, and I hope that helped anyone else just to have like a little bit of an explanation of what PCOS is. So again, I say if you feel like you are experiencing some of these symptoms, please consult a medical professional, your primary care doctor or an OB/GYN doctor, and ask more questions about PCOS. One of the things that I did is I've been experiencing these symptoms for years. Even as a teenager, I have experienced heavy periods, extreme, severe cramping. I did develop cysts as a teenager. I don't know if I've developed them as an adult because my concerns were never taken seriously. Let's just put it that way. So I have been experiencing these symptoms for years, but because it wasn't, and I wouldn't say it wasn't seen as something serious. It just, in my household, my mom experienced what she experienced and she didn't know like to take it seriously. And so when I was experiencing these things, same here. But I advocated for myself. A friend pushed me to say, hey, I think you might have PCOS, because I was like complaining about all of these things that I've experienced. And I found a doctor that would listen to me. And at first the doctor was kind of like, stay off Google. But she did the test and she came back and was like, yeah, these 2 blood test results are indicators that you have PCOS. And she actually referred me to the weight loss surgery team that I went to for my surgery for a consultation, and that the rest is history. So I'm saying that to say, even if you feel like you're not being heard, advocate for yourself. Look for a OB-GYN or OB doctor that would listen to your concerns and take it seriously. Don't give up on yourself, because let me just say, PCOS is, people can just look at it and they're like, yeah, it's just another thing, but it is really, really debilitating. It can really affect your life. I've known so many women who've struggled with infertility due to PCOS, and it is a struggle. So it is nothing lightly to take. For me, it was very hard on me, and it made things worse as far as my other health conditions. So PCOS is very serious, and in honor of PCOS awareness, I hope all of the information that I share with you is helpful. Again, I reference the site womenshealth.gov. Please go on there and get all the information that you need about PCOS, but please consult with a medical professional if you think you might be experiencing some of the symptoms related to PCOS. And thank you for tuning in, and come back soon. More videos will be coming out, and yes, that's it. You guys have a blessed one.